So if you're a member of the Hillsborough Chamber, we appreciate your support and investment in our organization and hope that you have found benefit from the many programs that we offer. If you're not currently a member of the Hillsborough Chamber, we would certainly welcome your support of our work and the efforts that we've been undertaking during the pandemic. Besides free educational programs like you're experiencing today, the Hillsborough Chamber has a lot of free marketing opportunities and programs that we would certainly want to offer you as an investor in our organization. Dara Schumacher is happy to have a conversation with you about what it takes to become a member of the Hillsborough Chamber. And finally, very special thanks to our Small Business Solutions Series sponsor, Hawthorne Farm Athletic Club, and for providing our Wellness Minute this morning. And representing Hawthorne Farm Athletic Club is Heidi Sivers-Boyce, PhD. Heidi, I'm going to turn the floor over to you and just make sure that you are a co-host.
Thank you.
There you go. You should be able to share your screen.
Well, thank you so much for having me. I've just got a quick little Wellness Minute video I can display here while we let more people join the call this morning. Hi, my name is Heidi Sivers-Boyce, President of Hawthorne Farm Athletic Club, proud sponsor of the Chamber's Small Business Solutions Series. Hawthorne Farm is a local and family-owned business. We've been serving Hillsborough and health for years, but none quite like the last year. The unique and extreme challenges of this pandemic, not just on our business, but on everybody's health, have strengthened and clarified our mission. It's taken a lot for my leadership team and I to stay healthy ourselves over the last year. The challenge has made us stronger, and it's also made us even more passionate about sharing what we do with others, specifically other business leaders, which is why we created these Wellness Minutes. No business solution is going to last if you don't take care of yourself and your team, the people you are depending on to implement that solution. We all know taking care of our health is important. We know that being physically active, working on our mindset and our stress management is essential. But the daily reality of the demands of life, especially now, can make maintaining healthy habits hard or just feel like another overwhelming to do. So it's super important you have support. In the last Wellness Minute, I asked everyone, who and what are your fitness enablers? I encourage you to look around in your life, identify what encourages you or who motivates you to take care of yourself every day. At Hawthorne Farm, when the pandemic suddenly changed our in-person indoor business model, we adapted to the challenge by seeing ourselves as fitness enablers. We do everything we can to remove obstacles and keep our community motivated and active and healthy, from home, outside, wherever they need to be to do it. While the last year has been hard, it's also been super powerful. I hope you did take that moment to seek out the fitness enablers in your life. For today's Wellness Minute, I want to encourage you to make a plan. Not a big plan, not another monster to do that just adds to your stress, a simple, straightforward plan for a minimum amount of activity that you can do every day. For me, no matter what, it's become 20 minutes, 7:30 p.m. at night. I do walking or yoga. That's it. I might get in more activity than that, more workouts, I might not, but every day I know I have those 20 minutes. And they've really come to feel like a gift to myself that I take. For you, it might be 5 minutes of stretching, or it might be an hour of sweating. Meet yourself where you're at, whatever works for you. Putting physical activity on your calendar in a plan is one of the single most consistent habits of successful entrepreneurs. Our lives are notoriously difficult to predict, constantly changing, especially with our topic here today on mask wearing and policies in our businesses. Please give yourself that small bit of consistency. Once you have a habit, you can grow it, keeping yourself strong and healthy through it all. And of course, if you think we can help, please don't hesitate to reach out to Hillsborough's own Hawthorne Farm Athletic Club. Thank you so much.
Thank you, Heidi. Truly appreciate your support of our Small Business Solutions Series workshops. So we have a ton of information to get through this morning. So let's get started. It is my pleasure to welcome back, and I think this is our third time that we've had Alita Fitz from Washington County Emergency Management Coordination Center with us. And Alita, thank you. Truly appreciate the fact that every time I call and say, can you say yes. So I'm going to turn the program over to you. And do you need to share your screen?
Hi, good morning. Yes, I would love to share my screen if possible.
Perfect. Let me see if I can make you a co-host.
All right, thank you. And then Heidi made it seem really easy. I'm not used to Zoom. We use Microsoft Teams, so we'll see how this goes.
So do you have the share screen?
Yes.
Perfect.
Let's see. Can everybody see that?
You did great.
Wonderful. All right. Well, thank you guys so much for having me today. Good morning. My name is Alita Fitz. I'm an emergency management coordinator with Washington County. Beginning of COVID, I started as the liaison officer in our emergency operations center. Since that has closed down in August, September time, I've now transitioned over to the vaccine planning team, and I've been working on vaccine clinics in our county. And I'm really happy to step back into the liaison officer role and try to make the guidance that's coming out from the state and federal level a little bit more easy to understand, giving practical tips and making it seem not so insurmountable. So today's agenda, I will talk about the new mask guidance and then reopening and what low risk means for us, cover some resources, and then open it up to any questions you might have. So to start off with the new mask guidance, so the CDC made an announcement on May 13th saying that vaccinated individuals would not have to wear masks in public places. So Oregon followed up that guidance with their own announcement stating something similar. So since then, we've been in a holding pattern wondering, what does that mean? How do we implement that? What guidance is there? So yesterday, they finally came out with their interim guidance. They are working on something that's a little bit more comprehensive and should answer some more of our questions. But in the meantime, we know that masks do not need to be worn in public spaces. So this is for anyone, whether you're vaccinated, halfway vaccinated, fully vaccinated. Anyone doesn't have to wear a mask outdoors in a public space. You don't have to wear one in your own home or backyard. Again, that's anyone. And then you won't have to wear a mask in a business or faith institution who's opted into checking vaccination status. And so that's only if you're fully vaccinated. So I'll get into a little bit more of what that means throughout this presentation. But OHA did put out two pieces of guidance for us to look at. The first is the updated mask guidance, and the second is the interim guidance for fully vaccinated individuals. So I have those links here in case you want to look at them later after this presentation, but I will walk you through the highlights of it and what's listed in there. So the new mask guidance does not apply to public transportation. So that includes airports and airplanes, as well as TriMet buses and rideshare services like Uber and Lyft. Doesn't apply to childcare settings, K through 12 public or private schools, licensed healthcare facilities, healthcare offices like your pediatrician or your family doctor, houseless shelters or transitional housing, adult jails, youth detention centers, or correctional facilities. It also does not apply to any workplaces that are following or OSHA's workplace rules, and I do have a couple slides later on that as well. It doesn't apply in your private homes. So one of the biggest parts of this guidance is that allowing maskless entry into your business is optional. You do not have to provide this if you are more comfortable staying with requiring masks and social distancing for all customers in your businesses. So you do have those two options. You either continue requiring masks for all people who come in, or you allow maskless entry and no social distancing, but you need to verify vaccine status upon entry. You can't just let people come in without a mask without checking to make sure they're fully vaccinated. So under this new guidance, you can implement your own rules as long as they're more restrictive than OHA. So if you want to keep your customers even more safe than what this current guidance says, you can do that and you are within your rights as a business. But what you can't do is just say, anyone is welcome to come in. We're not checking. You don't have to wear a mask, whatever you want to do, because that's less restrictive. And then that could be enforced by OLCC, OSHA, or local public health authority. And then regardless of the choice that you make, please post signs to inform your customers, put it out in the parking lot, put it on your front door, put it in a newsletter, put it on social media. Just try to get that information out there as much as you possibly can. With every business being able to make their own decisions, it might get hard for customers to remember what they need to do at which business. So it's really good to put that information out as widely as you possibly can. And then regardless of what choice you make, you also cannot resume operations at full capacity. So we will talk about, we are still in the risk framework where we use low, moderate, high, and extreme risk. And as Deanna said earlier today, we are moving to low, so I'll cover that later in the presentation. So these are kind of two separate lines of guidance that you need to follow. So if you opt into allowing maskless entry, you have to have a policy for checking proof of vaccination status for individuals. You also have to request the proof of vaccination status for each individual. So it's not good enough just to say, oh yeah, we have it written down on paper. You actually have to do it and implement it in your business at points of entry, and then review the proof of vaccination. You also must allow somebody to still wear a mask if that's what they want to do. Even if you allow maskless entry and someone says, no, I feel more comfortable, let them do that. That's fine. It's making them feel more protected. And the last thing I recommend is consider keeping disposable masks at the entry in case someone forgets. And because every business is going to be different, you might have somebody who's used to walking in now and checking their vaccination status and not having a mask in their pocket, but you might do it differently. So by having extra masks at the front door, you kind of negate any issues that might happen if somebody wasn't aware of what your policy is. And so then just as a reminder, if you do need disposable masks, you can order them from a business recovery center. And I've got the link a little later in the presentation. And then Deanna, just a reminder for you, as the Chamber of Commerce or the Business Recovery Center, you can still request these disposable masks for free from the county. So we do have a lot, and we're able to provide that for free to both the Business Recovery Centers and through them to the businesses. So let's talk about verifying vaccination status. So if you put this process in place and you're going to be checking verification, when you're looking at the document that somebody has provided, it has to have their person's name on it, their date of birth, the name of the vaccine that they received, the location where they received that vaccine, and the date of vaccination. And so you'll have 2 entries on there if you've done Pfizer or Moderna, and you'll have 1 for J&J. So all pieces of information there are what you need to find. A document can be the original one, it can be a copy, and it can even be a photo of the document, as long as it has those information. And documentation can include, but it's not limited to just the CDC card. I know we've seen that a lot on Facebook. People are putting up posting, and that's what everybody gets when they get their vaccine. But the information is also put into a state database called Alert. And in some cases, you might have a copy of that record, which is on official letterhead. It's a 1 to 2 page document. It still contains all of those 5 pieces of information. So while we're all used to the CDC's vaccination record, there might be other documentation that doctors' offices give out, that the state gives out, that maybe even public health gives out. And then yesterday on the media availability call from the OHA talking about this, there's a little bit mixed guidance about keeping records of the people who have shown that they have been vaccinated. So we're hoping that that's going to get a little bit more fleshed out when they come out with more guidance. So when we talk about keeping records, right, that's a list, and writing somebody down and saying, yes, they've been vaccinated, and then, verifying the next time, oh, you're already on our list, we don't need to see your card again. So it may be a good idea for employees, since they are trusted in your workplace and you work with them all the time, it's easier to communicate why you're keeping the list or the record. And that way they don't have to show you their card every single time they come in for a shift. It's not required for customers, and I think it's kind of a a tricky line there to walk on whether or not you're going to keep the records and write people's names down versus just verify them every single time they come in. It might be a little harder for people to understand why you also have to write it down, not just see the card that they're showing. So I would say right now it's up to the business how you want to proceed, and then we'll wait for OHA to see if they give us more guidance on how best to navigate that. So let's get into some what if scenarios. So you're a business and you've decided that you're going to allow people to show proof of vaccination so that they can have maskless entry. So what if somebody refuses to show you proof of vaccination? Well, then they need to wear a mask in the building and practice social distancing. So it's not required that they show you that proof of vaccination. It just means they don't get the perk of being maskless unless they show that. So they would need to wear a mask if they don't want to show you proof. What if somebody is unvaccinated? Same thing, they have to wear the mask in the building and practice social distancing. What if somebody has a fake card? We know that it's really easy right now. We've heard reports that if they're out on eBay, people can copy them very easily. There's nothing to say that it is an official document. So you as the business are not responsible for verifying the authenticity of the card. You're just looking at it from the standpoint of, do they have those 5 pieces of information that say that they would be fully vaccinated? And if they do and you say yes, then you're allowed in. It's not on you to make sure that they actually are telling the truth. And we are hoping that most people won't lie or break rules. Obviously, there are going to be some people out there, but everybody makes their own decisions. And that's unfortunately the world we live in and where we have to leave that situation. What if your business receives threats about requiring proof of vaccination? Or if the person is on site, the first idea is to get a manager or supervisor to help handle the customer, kind of talk them through what's going on. So explain the options, that they can still wear a mask or that they would need to wear a mask if they don't want to show proof of vaccination. You're not forcing them or requiring them to. Also explain that this is a state rule, so it's not up to you as the business. You're not allowed to make anything less restrictive. So even if you didn't want to require proof of vaccination, you couldn't under this current guidance. And then if things are still getting worse, reach out to law enforcement and get some help if this person is making really bad threats or making a huge scene that would cause a safety issue to you, your employees, or your customers. And then the final one, what if somebody yells at you saying this is a HIPAA violation? I think we've seen that a lot on Facebook, or people starting to say, you can't ask me that, it's a HIPAA violation. Well, it's technically not HIPAA to ask somebody to talk about themselves. What you can't do is call up the county public health and say, oh, is such and such vaccinated? Because then we're talking about somebody who's not in the conversation. But if you're asking somebody to talk about themselves, they're allowed to give that information to you. There's no rules against that. So for any of the businesses who fall under or OSHA's authority, they do have different rules. And so it is noted in the guidance that or OSHA's rules are more stringent and more strict than what the OHA guidance is. But if you're normally under OSHA's authority, you have to follow this guidance, even though it's more strict. So they published a new rule on May 4th, 2021. We used to be in the temporary COVID rule, which started back in November, but that ran out in about 180 days, which is why this new rule is here and it replaces all of that temporary rule. This new rule went through normal processes, which means it has no end date assigned currently. It will remain in effect until otherwise noted. The new rule does say that they will be meeting with a committee every couple of months or so to revise the risk of COVID in workplaces, to figure out if they can scale back on any of the rules and when they can sunset this guidance. Right, because the sole purpose of this guidance is to protect people from COVID in the workplace. Once COVID is no longer a threat, or we figured out the ways to live with them without COVID really impacting us, this rule is no longer necessary and can go away. So the guidance says the committee will first meet as early as July and then meet every 2 months or so after that to see when they can get rid of the rule. This new rule keeps mostly everything the same as the temporary rule that we've had since November. But it does still require masks to be worn outside and within 6 feet of other employees, inside and within 6 feet of other employees, when you're in a shared vehicle with other employees, unless that other employee is from your same household as well. And then something new it adds is that masks need to be worn when an employee is sharing a room with somebody else, when that total enclosed space cannot provide at least 100 square feet per person. So I think this really will work in an office setting when you have cubicles. If you've got 10 cubicles, but only 2 people sharing those spaces at any one time, you might hit that 100 square feet per person where they won't have to wear a mask in that setting. This guidance also says you must allow employees to wear masks even when it's not strictly required in that area. So allow them to do whatever makes them feel safe, even if you have something saying you don't have to wear it in your cubicle. And the last thing that they've added in is a note that employers who have 10 employees or more and have existing ventilation systems need to state in writing to the best of their knowledge that their systems are running in line with the requirements listed in the OSHA guidance. It doesn't say that you need to upgrade your systems or buy them from scratch if you don't have them at all. It's just making sure that what you have meets the checklist that they've put out in terms of requirements. So there were a couple of signs that you can put out in your business depending on which way you choose. This is the newest one that they put out yesterday about kind of a flow chart of what to do if you're fully vaccinated or not fully vaccinated. So the link is here if you want to print it out. I think that they are starting to work on translated versions, but they got the English one out pretty quickly. If you have decided to stay with the face coverings and not check the verification status or vaccination status, then those signs are still on OHA and they're probably still up in your business already. So you can just keep reusing the same one that you already have. They also put out a second one that talks about proof of vaccination. And so it's already in English. It's got a couple little areas for you to add some information that's personalized to your own business. So you can put that around either the parking lots or the front doors as well. And the link is below to print that one out as well. All right, so a couple of things that we don't know yet about mask guidance and kind of the new area we're moving into is what will enforcement look like at the county and state level? So we know that all throughout COVID, OLCC and OSHA and public health have been doing enforcement of the rules from OHA. And we do know that this new mask guidance is enforceable by those 3 agencies, but the actual nitty gritty of what enforcing is going to look like is still being determined. So for a while, these 3 organizations have taken the stance of education. If they see that social distancing isn't being adhered to or somebody is not following the guidance that was put out by OHA, they tend to go with education first to help make sure that the business is able to make changes or aware of what they need to follow. So that will likely be still in effect. We just don't know what the rest of it looks like because we've heard reports too, you know, businesses are getting shut down or they lose their OLCC license. So there's still a reporting process. It's the same thing as what you went through for enforcement wise pre this guidance, and then they'll follow up in their standard COVID fashion now to hopefully start with education. Another thing that we don't know is what if something is wrong with my card? So we get this question a lot at vaccine clinics, like, can I have 2 cards stapled together? What if my name changed halfway through my vaccination status? You know, is it okay if I laminated it? Because sometimes you hear people aren't allowed to do that. So we are looking for more guidance from OHA, and we will be putting out messaging on our Facebook, on our website, once we have information about that. And then the last thing that we're looking for is additional guidance on maintaining lists and the information of who is vaccinated and when they come into your store. So hopefully those things will be updated in the next round of guidance, as well as a little bit more clarity on the actual operations of how you can verify and check vaccination status. So for reopening and low risk, one of the other announcements that the governor made late last week was that we will get rid of this risk matrix system if all of Oregon reaches 70% of the population 16 and older vaccinated. So currently, Oregon is at 58.9% of people 16 and older vaccinated. So we still have a little bit until we reach that 70% mark. But in addition to that, she's given options for counties to be able to move to low risk without all of Oregon reaching that 70%. So once a county reaches 65% of their population 16 and older vaccinated, they can move into lower risk. And that is what we have been provided and will we start doing on May 21st. So I put a picture here and also the link, you can see the entire guidance table, but in terms of being in low risk and what does that mean for operations? It means at a gathering at your household, you can have 10 people from up to 4 different households. If you do indoor dining, first of all, that is allowed, and you can have up to 50% of your normal capacity in the building at a time. So that's a huge increase. I think we used to be at 25%, so we're definitely letting more people now in. Outdoors, you can have 300 people max outdoors. In faith institutions, you can do up to 75% people. Then for gyms, outdoor recreation, fitness establishments, you're at 50%. You're allowed to do contact sports. You can have some people maskless if they verified that they are fully vaccinated, and you can have people masks all playing together with those contact sports inside and outside. And then for retail stores, you're up to also 75%. So this is where we are currently. We'll start that on Friday, and it will be assessed weekly. So we have to keep hitting the markers that they've told us to hit. And if they add any additional verification for us, we'll have to keep doing that each week to make sure we stay in lower risk. So that will be updated on our website each week to make sure that we can stay operating this way. So a lot of this hinges on being vaccinated and getting a lot of our population vaccinated. So I wanted to give some information on how that is possible in case you or any of your employees are still looking for opportunities. So the first link I put on there is Washington County's vaccine page, and that has all of the information that we know about vaccine opportunities. It has links to where you can register for an appointment. It's got information on where walk-ins are accepted. It's a really good location to go just to get all of the information you could find about getting vaccinated. So I put a couple of highlights here from that website. So the Oregon Convention Center is taking walk-ins. You can get an appointment still, and the link is on our website, but they do take walk-ins during their normal operating hours in case you think, I just have an extra hour, let me go get that done really quickly. So that's an option. Most pharmacies in our county are providing appointments as well. So Walgreens, Fred Meyer's, Albertsons, and Safeway. So Costco as well. I believe that information is on our website, and there's links to each of the web pages so you can look at exactly what is needed for their appointments. We have a lot of Washington County sponsored events coming up. So we have Moderna and J&J. Our last Moderna clinic is this Saturday. Still a lot of spots available, so you can use that link or share it out with anybody you know. And J&J will be available for the next 4 weeks at all of our clinics, and we'll do walk-ins for J&J as well. And so all of that information is on that scheduling link. Our clinics switch between St. Anthony's Church in Tigard and the Hillsborough Senior Center in Hillsborough. So if you or anyone you know wants to get one at one of our clinics, the link is there. And then also, if we know that the CDC and FDA just approved Pfizer for 12 and older. We are working on several Pfizer opportunities. So we're working with each of the school districts. We're working with Columbia Sportswear and a couple of the health organizations like Providence to provide Pfizer clinics. No scheduling links available for that to my knowledge, but they are getting put up on the vaccine page if you need them at all. And then the last thing I put up on this page is our vaccine appointment assistance line. So it's a 1-800 number line. We are able to take calls in all of our safe harbor languages. English and Spanish are answered live. All other languages, you leave a voicemail first, and then somebody will call you back and help you get scheduled for an appointment. So that number and information is right there on the right of the screen. So then we have some resources I want to just float your way in case you want to do a deeper dive or are looking for some more information as people become more vaccinated and as the world opens up a little bit more. So the CDC has posted a site of post-vaccination considerations for workplaces. So the site talks about the strategies to appropriately evaluate and manage employees who have signs and symptoms after receiving a COVID vaccine. So it dives into what is a normal symptom from a COVID vaccine, and what is a COVID symptom that you wouldn't actually see from the vaccine. So you can start understanding, oh, if I'm seeing that they are shaking and they have a fever, that could be this option, it could be that option. So to help you understand that a little bit more. It also talks about considerations to minimize the effect of post-vaccination signs and symptoms in the workplaces. So I think one of the biggest ones is, if possible, allowing somebody to take the day off after their vaccine if they are feeling a lot of symptoms afterwards, and just because it could be kind of nerve-wracking to another employee or a customer to see somebody who has a fever, who is sweating a lot and has body aches, even though we know it's from the vaccine, just giving them the opportunity to stay home and run through those symptoms without having to be at work. The site also talks about how to assess and respond to post-vaccination symptoms. So what is typical, what is not. And it was last updated in early April. And I've put the link there in case you want any more information for that. So a couple other resources that we have. So I've linked the OHA mask guidance page. It hasn't been updated yet. It does have a bar at the top that says we're working on an update based on the 13th guidance from the CDC, and it'll change once everything's ready. It does have the newest guidance on there, so that is available, but the rest of the text in the page isn't yet. Then if you need to order some face coverings for your business, I linked the business recovery centers. I've also added the CDC guidance for fully vaccinated individuals or OSHA's rule that came out on May 4th. If you want a deeper dive, or if you are one of those agencies who is covered under that rule, just check that out to make sure you are still compliant. And then if you are one of the workplaces that are under OSHA, I've added the consultation services in case you have any questions, in case you need any help from OSHA to make sure that you are following their guidance properly, or how you can make sure that that guidance is tailored to your situation and your business. All right, and I will now take questions. I'm going to stop sharing my screen, I think, so I can look at everyone.
Thank you so much. I know we have several questions in the chat. Why don't Elizabeth Case, who's one of our Small Business Entrepreneurial Council members, has agreed to help me with the chat. If you haven't put your question in the chat, but you have a question, please use the raised hand feature. We'll do the questions in the chat, and then we'll go to the folks that have their hands raised. Elizabeth.
Sounds like a plan. All right, first question is from Vanessa Walls. It says, do you have a template to ask for vaccination verification? And I think a quick preemptive question to that is, you referenced there are a ton of links in that presentation. Is that presentation going to be made available for us that we can get it, so that we can get those links easily?
Yes, absolutely. Okay. I can send it out to Deanna and she'll make sure that everyone gets it.
Perfect, thank you. All right, so then the question, do you have a template to ask for vaccination verification?
No, at this point, I don't. I do have somebody on the phone from our enforcement branch. His name is Nick. I would pass it over to him if he's available, but I'll also keep my eye out in case OHA puts out anything or somebody else in public health, and we can pass it along. But since this is so new right now, I think nobody's come up with the actual how to do this, just that it can be done.
Looks like Nick is popping up there.
Yeah, hi, good morning. My name is Nick. I work for the Washington County Health Department. And we've been responding to a lot of complaints, concerns, questions about interpretation, stuff like that. And so for this one specifically, it's going to follow what a lot of the other policies have before. It's really up to the business to determine what that looks like for your unique operation. And so I know it was mentioned here toward the end, the OSHA consultation page. That's a good resource. Or if you have a legal team that wants to come up with your own template, it's really up to each individual operation. And that's unfortunately all that I can give you as far as the template goes on that.
Thanks, Nick. Appreciate that. John Gimry had the question of requirement for ventilation notice for employers with 10 or more employees. Is that per location or for all locations within Oregon State?
Interesting. I didn't dive deep into that. I would think that it's for all locations throughout Oregon State, but I will go through the guidance to see if it touches on that and send an answer.
Okay, thank you. And then Brad Smith had the question, is the OSHA mask requirement the same for vaccinated employees?
Yes. Yeah, so OSHA doesn't do anything in terms of vaccination status at this point. They are staying the same with it. The mask guidance is for all non-vaccinated and vaccinated employees. There's no distinguishment.
And then Norma Perez asked, what if a card does not list the location of the vaccination?
I think that's a tough one, and it might be up to the business to decide how they want to interpret. So there is a box on the CDC card on the far right. Sometimes it's a logo that somebody puts in there. Sometimes it's a signature. So each of the clinics has been doing it a little differently. And I would say if that is filled out in a way that looks official, and I don't unfortunately know, more than that, that would be, I think, at the point where the business can say, we did our due diligence, it's filled out, this is what we assume is happening.
Okay, that sounds good. John Gimry had another question that I think will be helpful for lots of retailers. Are we allowed to have two policies within one location based on work areas that are separated, such as a backroom, stockroom policy for employees, i.e. maskless with proof of vaccination, plus another policy for the room with customer entry and interactions where masks might be required?
I don't see why not. That sounds like a really good idea. I'm going to pass that over to Nick too, just to make sure I'm not speaking out of turn here.
Yeah, no, I think that sounds like a solid plan to make sure that you're covering your bases from every aspect. And like I said before, each operation, each business is unique, depending on the space that you have available, as well as the work that you do. So as long as you're covering your bases and you're assuming that risk and operating in a way that you feel is protecting your customers as well as your employees, I think that you're doing your due diligence there.
All right. Shanna at Arcade 2084 asked, when checking the date of the vaccine on the card, is there a waiting period for full vaccination? Is it 2 weeks for all 3 vaccines? Because I thought I heard a rumor about, she didn't say this, I'm saying this. I thought I heard a rumor that Moderna was only a week. So is everybody 2 weeks?
Yep, so 14 days after the second dose for all 3 vaccines.
Okay. Sorry.
I was gonna say, sorry, something that we've noticed in our clinics, which is helpful and can kind of apply to this situation. It's very similar to the buying tobacco or buying alcohol, where you say, if you were born after this date, you can't do it. Having something out front as a really quick verification for whoever is checking the vaccine status. If their last dose was after this date, they're not fully vaccinated yet or something, and have that updated every day. So you have that date really easy to access.
Got it. Excellent. Studio A asked, could Washington County move back to a high risk level in the next few weeks? And what would make that happen? And how do we fight them so it doesn't?
Yes, I think that is a possibility since it does get reviewed weekly. And I would think that the slide back to moderate or high will happen if we see a really high spike in case counts or in our hospitalization counts. And so if we see that our hospitals are starting to go on divert, which means they can't accept any more patients in the ER, or if their beds are becoming really full, specifically with COVID patients, we might bump up to moderate just to give them a little buffer to work through all of that and get back to a normal operating capacity.
Great, thank you. Heidi at Hawthorne Farm Athletic Club asked, our industry has specific sector guidance, specifically the childcare, specifically drop-in childcare must be closed. I need more coffee. Steam and sauna must be closed. We're committed to safety. This is also a big business impact and something people are really seeking in their self-care. My question is this sector guidance still in effect, and how will we know when those details end?
Yes, so the sector guidance links to our risk levels. So you still have to follow that while following whether or not you're going to allow masks. It's kind of two separate issues. And so the sector guidance will end or be updated to be much smaller once we hit that 70% in Oregon. But until then, all of those rules are in effect.
Great, thank you. Andrea Montera, who is a licensed massage therapist, has a massage therapy clinic that, but also healthcare providers since they take insurance. Our LMTs are vaccinated, but one of our admin staff has made the choice to not vaccinate, which is her right. Can we, as a private business, keep our mask policy for common areas like the reception area?
Yeah, I would actually say if you're calling yourself a healthcare provider and you fall under healthcare clinic, then you have to require masks in the common areas, right? If you remember, the beginning of the presentation said, this is where this doesn't apply. Healthcare settings was one of those.
Okay, so then I guess a question for a non-healthcare, for the rest of the people on this call who are like, oh, that was going to be my question too. I didn't need it, but they're not a healthcare. How do we, what about them? Keeping a policy?
Yeah, and so I think it's very similar to that question about the employee break room and then where all of the customers are. So you can have policies differ by the area, the amount of people that are going to be in there and the types of people that are going to be in there. So that all depends on what you as a business need and what your workplace looks like. And so it's really up to the business, whatever they feel most comfortable with.
Great, thank you. Karen asked, this is a good question. What do we need to do as far as the contact tracing forms that people have signed to show when they came into the facility or building? Do we keep them for a year or 5 years? And what is that expectation?
That is a very good question. I don't think I know that off the top of my head. Nick, do you have any insight? Because I can go back to maybe one of our epidemiologists or somebody in public health and get a better answer.
Yeah, I was actually going to recommend the workplace support strike team. They would have a better understanding of what that responsibility is. I actually don't know that answer either, though, so I apologize for that.
Right. Nice job, Karen. You stumped him. That is the end of the questions in the chat. You can keep them coming, and I will continue to interrupt. Oh, John said, would we be allowed to keep a scan or photo of an employee's vaccination card?
That's kind of that iffy area that we don't really know much about yet. So I'm sorry, I don't have a good answer for that yet.
I was talking to the gym that I work out at. It's a smaller gym where there's only 10 people allowed at a time. And they're trying to figure out a similar situation for members who are coming in 4 or 5 days a week. Do they need to show that vaccination card every single day to every single instructor? Or is there, are they able to keep a database? Doesn't necessarily need the copy of the vaccination card, but could just have a check mark of they showed somebody their card, so it's okay when they come in to take off their mask, kind of a thing. Is that acceptable?
Potentially, and I would also think running it by your customers to see how they feel about this, and then maybe not requiring that as the only thing you can do to be maskless. If they're interested in putting their name on that list so they don't have to show it every time, then make that an option. But if they would rather not have that information stored by you, then I would enforce it, I think.
Okay, thank you. Monica asked, could photo ID be requested when verifying proof of vaccination to better match the person to the card?
Yes. Yeah, if that is something that your business wants to do that is allowed, that falls into that more restricted guidance than OHA. And that is a good point, right? Because you have your name and birthday on there, but not a picture. So having that ID to match up those would help. So that's up to the business.
Yeah, I was surprised at the Hops game last night when I did that. They asked for the proof of vaccination, and I showed a copy of my vaccination card, and they didn't ask for my ID, and I kind of expected them to ask for it. So that was a good question, Monica. Other questions? Or would you like to raise your hand and ask the question yourself and not have me as your interpreter, which is going so well for everybody so far?
You have done a great job, Elizabeth. Thank you so much for doing that.
Absolutely.
Just, a couple of comments, I guess I would ask. The struggle here, obviously, is the fact that our businesses, our beleaguered businesses, are now, the problem. They're going to have somebody at the front desk, that's checking those cards. I think the group we have with us here today, really I appreciate their civility and approaching this topic. The unfortunate part is that they have, a lot of folks that are walking through the door that have an entirely different feeling about being asked these kinds of things. And so I guess, the keys to our economic, freedom and prosperity is the vaccination. That's also the way that we can get out from under these, rather onerous regulations and, potentially difficult interactions between a customer base and employees and helping them. The one thing I would like to offer, that the chamber would certainly put together, if you're willing and want to share whatever guidance you come up with, we would create sort of a database where you can, access that and see what other businesses are doing and how they've, used their language, just get a sense of what they're doing. I know that there's, I read an article today about a business here in the Portland metropolitan region that ended up not opening because of the backlash that they faced in terms of what their guidance was going to look like. So, it is a difficult, tricky time, and I appreciate, Alita, that you've marched it out so succinctly for everyone. But I do know that after, when you go back as an employer and try to implement, you are going to run up against employees that are like, I'm not going to follow those rules. And so it does put employers and their employees in interesting dynamics, as well as, customers. And I think any sort of assistance that we can provide to our employers in how to help and coach their employees, especially their frontline employees that are going to be, interfacing with customers, super helpful. Anybody come up? Elizabeth, did we have more questions come into the chat while I was doing my little tirade here?
You were doing great. Colette had just asked, can you please reiterate, are we allowed to keep a photocopy of our clients and staff vaccine cards or not? I'm sorry, I missed that. And it sounds like it's not clear yet. So they don't know the issues around privacy. And Alita said, yes. So I'm just reading the chat now. So much fun. Thank you guys for all of that. Yeah, what other questions? If you want to raise your hand, Brad's got a question always.
So my understanding is if we get to the 70%, all mandates are lifted. Does that mean the mask requirement would be gone for vaccinated and unvaccinated? So this whole thing that we're dealing with right now could possibly not be an issue, or am I misunderstanding that?
Potentially. I don't think that they have really gone into that in detail. They do say that the risk matrix will disappear, but they might keep some of the guidance in place for a longer term. And so because they have that kind of blanket iffy statement, they might be keeping the masks for unvaccinated folks a little bit longer after they get the risk matrix taken away. But also once you hit 70%, as my understanding is, that is herd immunity. And at that point, it is safe for the population to have that few of people unvaccinated in an area.
Cheryl has a good question.
Sorry.
At outdoor markets with various entry points, how do we check masks and enforce the guidelines?
I think the easiest way would be to cut down the amount of access points, right? Because for every access point, you would need somebody there verifying, and you can do a stamp on a hand or some sort of sign that that person has been checked at one of the sites that they go into. But the more entries you have, the more people you have doing that. So cutting that down to a more manageable number of entries and exits might be the easiest option.
Heidi, go ahead.
Sorry, I can't find my little hand raised thing. We are in a business that serves kids 11 and under, and also has people who can't choose the vaccine for a medical reason, or it's not effective because their immune system. And I'm just wondering if you have any guidance. It's important to us to remain supporting this part of our population who don't have the choice yet, who would still be at risk even if 70% are vaccinated. Do you have any language or thoughts around that?
That is a really good question, Heidi. Thanks for bringing that up. And I know, so the children will still have to wear their masks, unfortunately, and you could maybe put some wording about wearing a mask if you are in that group who can't get vaccinated because of a medical reason. Wearing a mask will protect you better in these situations, and you are recommended to do that to stay safer, even though everyone around you might be vaccinated. So, and still following that 6 feet of distance rule, still trying to minimize contact to about 15 minutes will really reduce your risk of getting infected by someone. And on the call yesterday, a couple of things that Dean Seidlinger brought up when talking to the media was some really, I think, words of encouragement about people who are vaccinated, is that they won't be at risk for spreading the disease to those around them, or the infection to those around them. And if you are vaccinated, then you're also not at risk for being indoors of getting that from somebody who's not vaccinated. So I think it's really encouraging to hear that if somebody is not, or somebody is already vaccinated and they're mask free and you're not vaccinated and you're worried, there's a really low to minimal chance of them actually giving you the virus.
So while we have Nick with us, Nick, thank you for joining us. Give some advice to our businesses that run into, and I know, Alita, you touched on it in terms of sort of if it escalates, but I think that businesses are loath to call, law enforcement for disruptive customers. And so can you give us just some guidance in terms of, what an employer should sort of help train their frontline employees regarding these regulations and requirements, and, and if they get pushback, sort of what, other than saying, which I really appreciate the reminder, this is state guidance and guidelines. These are not businesses' whims of, this is what I feel and these are my political beliefs. Has nothing to do with it. Has everything to do with, in order for us to be doing, opening our business, these are the guidelines we have to follow. But Nick, anything else that you would maybe offer in terms of advice?
Yeah, absolutely. So, there's obviously a public safety element to this, no matter what. I understand that it can be a heated argument. I apologize for the background chatter. I got some distance learners here. But yeah, we want to make sure that if somebody gets hostile or anything like that, we separate between what is most important, right? We don't want to put anybody in the way of an altercation or anything like that. And there are levels to enforcing this within your own business. So if somebody is just completely non-compliant and has no interest in adhering to a policy, your next step is to refuse service to that individual, right? If you have an employee that can't get on board with whatever your policy is, you have administrative actions as an employer, and it's kind of important that we all reemphasize we're working together as a team here. And I think the biggest recommendation that I have is that when it comes to, those hot button issues or somebody that's getting really frustrated, you have to make that snap decision to whatever is best. And a little bit of non-compliance in order to save a fist fight, it's okay, right? I mean, somebody doesn't want to wear a mask. Okay, understood. Get in, get out. You're moving on to your next thing. That's the assumed risk that we all have to work with on a daily basis. It's okay to use a little bit of logic, and if that requires a little bit of non-compliance and it saves the safety of everybody on board, that's more important than somebody that's not wearing a mask or doesn't want to show their vaccination record. And so I don't know if that answers it, but yeah, I know we've gone through that a lot with a lot of our businesses, and that's been a concern all over the place. So hopefully that helps.
Thank you very much. I appreciate that. And I think also, businesses downloading some of the new signage. Yeah, I know that that somebody was telling me about a business yesterday, and the person just walked in the door, took off their mask, wasn't wearing a mask, and said, "I'm vaccinated," and I'm vaccinated. I don't need to do. And of course, the business owner, was unsure of what the guidelines were, and so basically tried to say, wait a second, but they just kept going. So, having that posted, on the door, and the unfortunate part is you probably have to have an employee resource that's going to be, checking those vaccination cards at the door to make sure that there's, they're following the rules and the guidelines. And then again, I think just providing them with that employee with as much information about, what the escalation process and policies are at your organization, who they need to contact or call, or bring up from the back room if you have a manager on site, just to make sure that everybody stays safe. That's my biggest concern, is that people get kind of wacky on these kind of situations, and we just want everybody to stay safe, and we want to get through this together and, give small business a break, for God's sakes. It's been a tough one for them, and really appreciate everything that everyone would do to make it as easy as possible for them to follow the guidelines and get back to, business as usual as much as possible. And the increased capacity, I mean, that's good news. That's exciting news. We're able to welcome more people in our businesses. That means our cash registers are going to be ringing more. All of that's a really good sign for our businesses and for our economy. So any final questions we do have one.
We do. I am just reading it.
Couple.
Oh, this is a great question to follow up, actually, from the outdoor market question, I think. But just to clarify, did you say at the very beginning that nobody has to wear a mask outdoors in any venue anymore?
So it's nobody has to wear a mask outdoors if it's a public place. So that's your parks, your sidewalks, things like that. But if you're at an outdoor concert venue, that's somebody's business, and now that's a private area. And so they can make their own rules.
Okay. And then Joelle,
we can't make our own policies about our employees, correct? Like our employees, that's the OSHA rule. The employees have to keep the mask on, right?
Mm-hmm.
Okay, I'll let you know when it's done.
Melissa,
Thank you.
you're on mute. All right, Joelle, are the larger retailers such as Costco, Target, et cetera, that we've seen on the news dropping their mask requirements true? And if so, are they checking vaccination status?
Yes, to my knowledge, they are true. And I would think that, yes, they have to. If this is Oregon state rule, if they have a business in our state, they'll have to check vaccination status. And I think that's going to be part of the enforcement and education, is making sure that these larger companies know they have to follow state rules, even if Oregon is different from New Jersey, is different from Texas. They're going to have to do what the locality says they need to do.
Excellent.
We have a hand raised from Jim Ricks-White. Jim.
Right.
Hey, so Bag and Baggage is going to return to theater in the summer in cooperation with the parks. Now this raises a question. We are working with the parks to figure out what the capacity of the parks that we are going to be doing the shows in is. Does that make the park an entertainment venue? And thus we have to go to the 50% rule and all of those things that apply to entertainment, or does the park remain a park?
That is a really good question and a tough one. And what I've done with every tough question is pass it to Nick.
Yeah, so we've actually had several questions like this that we've sent up to our Oregon reopening team for interpretation. And the answer we routinely get back is that it depends on the intent of the event. So if it's a park that's doing outdoor recreation and fitness, that's the guidance that you follow. If it's a park that's doing entertainment, while you're doing that entertainment type of event, you follow the entertainment guidance. And I know that might be frustrating and a lot to keep up with, and I totally understand that. But that's the answer that we've got back from the state.
Excellent. Any final questions? We are down. It is actually 11 o'clock right now. Alita, Nick, thank you so much. Heidi, thank you for your support of our Small Business Solution Workshop series. Really appreciate it. Just know that the Hillsborough Chamber will be staying in touch with the state of Oregon as well as Washington County as new rules and regulations are moved forward. If there's any changes to guidance, you'll hear it first here. So get connected to the Hillsborough Chamber. If you're not, sign up for our regular email notifications and you'll be on top of the latest and greatest information. Want to thank you all for participating. Truly appreciate it. Go about the rest of your day. Stay safe.